A 2024 law designed to strengthen parental rights is now under some heavy scrutiny. A 15-year-old Meridian student says Senate Bill 1329 is having unintended and potentially deadly consequences. The bill says parental consent is required for any medical decision for a minor. As we previously reported, the law is pretty broad and some schools take it very literally. The Boise School District doesn't allow Band-Aids or over-the-counter pain relievers to be handed out without parental consent. As Abby Wild reports, one student is against that bill after he was hung up on when he called the National Suicide Hotline and was told parental consent was needed for him to get help.
I called it at one point. It was very late. It was almost 6 months ago now.
It was 2 a.m. on a school night.
I was stressed out and I wanted somebody to talk to.
But within minutes, the call changed.
They told me there's a bill. It's called Senate Bill 1329, and this is what it means. And then explained that they had to hang up on me.
Senate Bill 1329 was passed into law in 2024. The Idaho law requires any healthcare provider to receive parental consent before treating a minor. 15-year-old Jace Woods says it doesn't stop at the doctor's office. It also affects kids who are calling the National Suicide Lifeline.
Unless you tell them on the line, I will kill myself right now if you do not keep talking to me, they can't keep talking to you. That is my experience.
The law states that if, after a reasonably diligent effort, the healthcare provider cannot locate or contact a parent of the minor child, and the minor child's life or health would be seriously endangered by further delay, then they can treat the child. But for Woods, he says he didn't see that urgency when he called 988, and he says he's not alone.
I know more than one person who has been hung up on.
In 2025, an amendment to the existing law was presented to the Senate State Affairs Committee.
We want to fine-tune just a little bit more language.
In the amendment, there's wording that states a provider can treat a minor, quote, if the minor child is accessing the services of the Idaho Crisis and Suicide Hotline or experiencing a mental health crisis and presents an imminent risk or serious injury to self or others.
When a teen is needing their parent the most and helping in this situation, so many teens can be emotional or think their parents are going to react one way.
But that amendment did not pass the House. In 2023, data from the Idaho Department of Health and Welfare shows that Idaho has the 4th highest suicide rate in the country and is the 2nd leading cause of death for teens and young adults.
We'll never know if those people were hung up on. But even if just one did, then this bill, because of a mistake in writing, has killed a child.
That's why Woods says Senate Bill 1329 needs to be amended this session.
It needs to go in now. We can't wait.
He says he's reached out to several lawmakers for change, but they've told him an amendment is in the Legislative Services Office.
We are almost a month into the session. It's very late for new bills.
Woods says this can't wait another year, and he says a new bill doesn't even need to be written. He simply wants the 2025 amendment to be written into law.
I don't want to repeal this bill necessarily. This is an issue of poor wording. This is an issue of a mistake in writing. And it shouldn't be a partisan issue to fix that mistake.
He says sometimes the only thing standing between a teen and a tragedy is having someone stay on the line.
Sometimes you just need someone to talk to. Someone who you know doesn't know you and you know will not judge you in any way. The suicide hotline has 988 and 741, and all of those lines have been that thing, that place where you could go.
And I did just hear back from the bill's sponsor, Representative Barbara Ehart. She says senators are working on updates to the bill and hope those will be introduced next week. She says those amendments would include 988 language in the law. However, she says in the original bill, 988 was always supposed to be allowed even without parental consent. Now, as a reminder, Justin, if you or anyone you know is experiencing suicidal thoughts or a mental health crisis, the National Suicide Prevention Lifeline is available 24/7 by dialing 988.
988, call that regardless. Abby, thank you. Important story there.